Well, we're behind the microphone with Dr. Klein of the Stages of Life. And Dr. Klein, let's talk about acid reflux because from what you've told me over our 7 or 8 years together, this isn't just as simple as taking something that you see advertised at night on TV. You can really jack yourself up.
Oh, and people do all the time. And this is one of the most common ways that we can cause our patients misery. We can cause ourselves problems and end up with lifelong threatening, just seriously life-threatening and limb-threatening illnesses. So reflux esophagitis, little heartburn, okay? Now, years ago, somebody would come in and they'd have heartburn. We would talk about, well, it's coming from stress and you're kicking out too much acid. And if you have this sort of thing, it's a precursor to peptic ulcer disease. So years ago, one of the most common of all surgeries was antrectomy vagotomy. What does this mean? It means they would take out a piece of your stomach and cut the vagus nerve so it wouldn't kick out acid. Then wouldn't you know it, okay, all this common medical wisdom turned out to be wrong, okay? It was caused by a bacterium. Okay, that bacterium, H. pylori, caused the ulcer. So what do we do now for ulcer disease? We give them antibiotics, along with something called a PPI, which is a proton pump inhibitor. By taking away the stomach acid, it allowed us to go after this particular bacterium. But what they're finding is it actually tends to cause the bacterial infection. Oh. That acid is there to protect you, not to hurt you. So we've got individuals that have a hard time sleeping at night. I am one of these individuals because when I lie down, in particular if I eat too much or too late at night, it causes the stomach acid to kick up from the stomach itself into the esophagus, passing through a structure that you are now going to learn about called the lower esophageal sphincter. This is a purse string. This is a muscle that contracts and keeps the acid from hitting the esophagus. But for whatever reason, should it weaken, you'll end up with problems of reflux. So what do we do as doctors? People come in, I've got this burning in my, I've got this persistent cough, and so what do? Knee jerk, okay? It's a great metaphor. And you go ahead and give them something along the lines of what we used to use, Tagamet, Prilosec. It could be the generic omeprazole, but it doesn't make any difference because we're going to take away your stomach acid and you're going to feel better immediately, and you do. You feel better immediately. If you had poison ivy and you scratched it, you would feel better immediately until you scratch someplace else and now you spread the wax that causes the poison ivy. When you take away the stomach acid, you will see immediate relief, but it makes the problem worse. So we tend to give it rather flippantly. We're going to give it to you and then you stay on it until the symptoms go away. Oddly enough, you're on these things forever. By taking away the stomach acid, a few bad things occur. And one miserable thing, and one horrible thing. The first thing that happens, okay, is that you take away the body's ability to digest amino acids, proteins. You need to have that acid or you will not digest proteins. So you'll end up with a relative malabsorption syndrome. Kind of interesting, okay? So now all of a sudden you can eat whatever proteins you want to, but you really can't digest them properly. Oh. Now this will lead to problems in several months to a year. So this is kind of a delayed action on that one. The second one, which is kind of cool, is when you take away the stomach acid, you open yourself up for food poisoning. If you have the stomach acid, it takes a certain inoculum, a certain amount of bacteria to cause illness because that stomach acid is a lot like a moat. Okay, it's there to protect you as well as anything else. We don't always wash our food that well. I'll bet you that you don't wash your vegetables with soapy water, okay, because that's what it would take to kill the E. coli and some of the other nasties. But guess what? That stomach acid will protect you until you take it away. So some well-meaning doctor, PA, nurse practitioner, whomever, is crippling the individual on this stuff for any length of time. The third thing is that you need that stomach acid for something magical, okay, called B12 absorption. So if you don't have stomach acid, your body cannot absorb and will not absorb vitamin B12, leading to all manners of problems. Some of them are just, my toes tingle. My fingers tingle, I can't taste food as I used to, or the development of dementia. So there's short-term issues and there are long-term issues to the effect that there used to be a black box warning on these H2 blockers not to use longer than 6 weeks because it will lead to a B12 deficiency. And it does. Magnesium deficiency, and the list keeps on going and going and going. Now, were that not bad enough? This is the one that fries me. By taking away the stomach acid, It takes away the stimulus for that purse string to contract at all. Why did this muscle become weakened? Because you had too little stomach acid, not because you had too much. As you get older, people secrete less and less stomach acid, thereby stimulating that LES, that sphincter, to contract. And so wouldn't you know it, this is where these individuals taking that apple cider vinegar. That really helps my stomach out. I've got this reflux. This apple cider vinegar helps. It does. You know why it helps? Because it's an acid. Okay? Acetic acid, for God's sake, stimulates the LES into contraction. So it's a lot like going to Gold's Gym. I'm not going to pick on Gold's Gym. That's just the only one I know about. And so you go out there and you work out. You have barbells, you have dumbbells, you have leg machines, you have abs. Well, this is the real ab machine. It will work the lower esophageal sphincter. It stimulates it to contract. So what do? Okay, we are crippling our patients 1 and 2 and hundreds at a time. Okay, I get people off the H2 blockers, off the PPIs, and should these individuals go nuts because you're taking them off these medications, we substitute something called sucralfate. You have to lose weight. You have to follow instructions. They are non-negotiable. Now, I have this problem, okay? I've had it for years. Did I take the H2 blockers? Nope, wouldn't touch them. Did I take the PPIs? Not a chance, wouldn't do it. I didn't do the basic thing. I didn't lose weight, okay? Weight on your stomach pushes the stomach contents up into your chest. The second thing I didn't do, which I now do, is to elevate the head of my bed or by sleeping on a wedge pillow or all that plus having additional pillows. By sitting with an incline, it keeps gravity working for me instead of against me, and wouldn't you know it, it starts to feel a whole lot better very quickly. So I lost 14 pounds in the month of January, and that made an 80% difference in the gastritis, the esophagitis, the pain, the misery, the heartburn. But what it didn't do is it didn't fix the cough. Now, a lot of people out there have a chronic cough. Okay, they keep clearing your throat, just feeling miserable about it. And this was me, to the point I felt like I had a fingernail stuck in the back of my throat. So I thought, I have to have cancer. It's got to be tonsillar cancer. It has got to be something miserable. So as I'm giving away my belongings, okay, my dear fiance says, why don't you go to the ENT doctor? And the answer is real simple. I don't want to go to the doctor's office. It's just not going to happen. I'm not going to sit around with a bunch of sick people. I just wouldn't do it. Well, she basically made the appropriate female threats if I didn't go. So I went. And he took this instrument and snaked it down from my nose to my vocal cords to get a look, to find out what's going on. Now, my vocal cords, understandably, are very important to me. Okay, I wouldn't be able to communicate with you right now without them. I use them, and I use them hard. They get beaten up badly. But I was coughing so hard that it was barking, really awful. I thought, you would think that I had tuberculosis. Okay, no, what I had was irritation of the vocal cords by the stomach acid being kicked up at night.
Oh, boy.
So he convinced me to do something against my better judgment. I decided, well, if I'm going to be the patient, I might as well listen to the doctor's advice. So he told me to do something very interesting. Drink hot water. Sip on hot water. It'll settle it down. Well, by some kind of serendipity, I was doing this already. So he said, well, good for you, but it wasn't working. He said, the next step, elevate the head of your bed. Well, I did it. It didn't really help enough. It helped a little bit. Lose weight. Been doing it, feeling better, but not quite right. And he said, last but not least, he wanted me to take some Pepsid. And I'm thinking, my God, this is just what I tell people not to do.
Yeah. But
very, very temporarily, I agreed to do it. So that we agreed on this, that I would take it for 2 nights in a row, be off it for 1 or 2 nights. This would allow the lower esophageal sphincter to remain stimulated. The cough is about gone. Okay? So I am not too old or too stubborn to learn something from a colleague. So I have to hand it off, with Dr. Barry Kang with Winter Park ENT. If you're listening, congratulations. You made a believer of me in this regard. However, I still take my Carafate, okay, which is keeping most everything under control. Sucralfate, that's how it's done. Lower esophageal sphincter notwithstanding, I'm feeling pretty darn good. My advice to you is as follows. Hot water, lose weight, elevate the head of your bed, and Pepsid, 20 milligram tablets over the counter. You take 2 of them, 2 out of 3 nights, 2 out of 4 nights in that range, and that should start straightening it out. That should start